Singapore, where the population is largely Asian and we are exposed to tropical sunlight, we do have a higher incidence of pigmentary disorders. In fact, studies show that a lot of the UV radiation happens before age 18. Therefore, by the time we reach our 20s and 30s, signs of skin damage already occur. So today, we'll discuss different types of pigmentation, superficial or deep, and the different modalities we choose to treat different levels of pigmentation. And we end off with a skincare regime that may help us with the pigmentation problems. So for superficial pigment, it includes conditions like freckles or post-inflammatory inflammation, post-acne, or minor abrasions or trauma to the skin. Superficial modalities of treatment include microdermal abrasion. With microdermal abrasion, a gentle mechanical brush sloughs away the damaged skin. In patients with dry and thin skin, we may in fact prescribe wet microdermal abrasion such as hydrofacial, where again the damaged skin is removed. Occasionally, when the pigmentation is deeper, we may prescribe chemical peel. My favorite chemical peel would be glycolic acid peel, a fruit-derived acid peel that has very little side effects such as scarring or deep burns. In the case of freckles, which are located in the epidermal-dermal junction, we may prescribe intense pulse light that utilizes 560 nanometers to ablate away the spots. Deeper pigmentation includes hormonal, such as melasma, or congenital, such as nevus of Ota. In the case of hormonal melasma, an IPL which is at 560 nanometers may not be deep enough to reach the pigment. Therefore, we may select a laser to hit deeper into the dermis. Its wavelength is at 1064 nanometers and therefore reaches a lot deeper than the IPL. However, it's usually not so clear-cut, and sometimes superficial lesions like solar lentigis also have a slightly deeper component, and melasma, which is usually deeper, may have a superficial component. Therefore, we may need to combine different modalities of treatment in order to clear the pigment. Knowing what type of pigmentation in which level helps us decide which modality of treatment to prescribe for you. To expedite the treatment process, we will also prescribe skincare that helps to lighten the skin. These skincare products usually contain arbutin, kojic acid, licorice, niacinamide, or we may also prescribe a medication that contains hydroquinone. It is important to be careful when you use a bleach because excess usage may cause skin irritation. We also advise patients to always avoid the sun, use sunblock, and wear a hat. So in conclusion, superficial pigment requires different modalities of treatment from deeper pigments. Occasionally, we need to combine different treatments to treat both the superficial and the deep components. And the longer the pigment has been there, the more sessions you need to clear the pigment. In this case, we ask patients to be very patient because pigmentation is a difficult problem that may require several treatments. But with perseverance and consistent treatment, I'm sure we'll be able to clear most of the pigment. We have several videos uploaded in our Facebook page, Singapore Aesthetic Centre, where we explain in depth the different types of pigment. If you have any inquiry, please call us at 9841-1000, write us an email at doctor@sgac.com.sg, or check our website www.sgac.com.sg. We hope to see you soon.